A nurse is caring for a patient receiving IV furosemide for pulmonary edema. Which assessment finding requires immediate action? This means we have a patient who has pulmonary edema. Pulmonary edema means fluid has accumulated in the lungs. To remove that fluid, we are giving IV furosemide. So, which assessment finding would require immediate action? First, a urine output of 200 milliliters in 2 hours. This means it's higher than normal. It's higher than normal, but that's what we want. That's why we gave furosemide, so that the fluid collected in the lungs can be expelled from the body, which will give the patient some relief in breathing. Normally, if we look at it, a patient should have a urine output of at least 30 milliliters per hour. So if we look at this, it's for 2 hours, which means 200 divided by 2, so 100 milliliters of urine output per hour. If 100 milliliters is being produced every hour, while we only needed 30 milliliters, or slightly more, 100 milliliters is being produced. This means it's quite high, but it's an expected effect. From this, we can say that the furosemide drug is starting to work. So this means we don't need to take immediate action on this. It's an expected finding. We are being asked for an answer that would be wrong in this context, which would be incorrect. So what does that mean? We don't need to take immediate action on this. So this one is wrong. A potassium level of 2.9 milliequivalents. When we give a patient furosemide, it's a loop diuretic. Because it's a loop diuretic, it flushes out potassium because it blocks the sodium, potassium, and chloride channels in the loop of Henle. By blocking them, potassium is expelled from the body, leading to hypokalemia. However, the normal level of potassium is 3.5 to 5.5 milliequivalents per liter. Now, if we look here, it's 2.9 milliequivalents. This means it's very low, which we call hypokalemia. If the patient has hypokalemia, after some time, dysrhythmia might occur, and they will start having cardiac problems. So for this, we need to take immediate action for the patient. Therefore, this option will be correct. The next option, a blood pressure of 100 over 60 millimeters of mercury, is a bit on the lower side, but it doesn't require such immediate action from us. So this will also be wrong. Mild dizziness on standing. When the patient stands up, they feel dizzy. This can happen when a patient is taking furosemide, but we don't need to take immediate action here, so this is also the wrong answer.